afternoon and a warm welcome to everyone joining us today. Thank you for taking the time to be part of this Viavikas webinar in collaboration with Tata 1MG, focused on a topic that is deeply relevant to all of us: the importance of vaccination and its role in reducing complications during hospitalization. At Viavikas, we closely work with seniors, families, and communities to enable healthier, more secure, and more engaged aging. In that spirit, I would also like to share an upcoming initiative that aligns through strongly with today's discussion. The TCS 10K run scheduled for 26th April 2026 is not just a strong sporting event but a movement for preventing health and active life. Via Vikas is proud to be the facilitator for this initiative, and we invite you to join us, participate, and support the larger cause of staying fit and preventing illness before it starts. Vaccination is one of the most powerful preventive tools we have today. It protects individuals, reduces the severity of illness, and significantly lowers the risk of complications, especially during hospitalization. Conversation like today's help us move from awareness to action, backed by medical evidence and real world experience. It's our pleasure to introduce today's speaker, Dr. Sarthak Chakravarti. Dr. Sarthak is an MBBS with a diploma in emergency medicine and over a decade of experience as a general and family physician. He specializes in adult vaccination programs, including influenza, pneumococcal, HPV, and shingle vaccines, and has extensive experience in managing lifestyle disorders and respiratory infections. An active member of professional bodies such as the Indian Medical Association, he is also involved in training junior doctors on vaccination protocols and patient counseling with a strong focus on evidence based preventive healthcare. We are grateful to Dr. Sarthak and Tata 1MG for partnering with us, and we look forward to an insightful and practical session. Once again, welcome to the webinar and hope this discussion empowers you to make informed health decisions and for yourself and your families. Over to you, Doctor.
Thank you, Ashwini, for the warm welcome. Good afternoon, everyone. My name is Dr. Satha, and today, me from 1MG, I will be discussing adult vaccinations, about their importance, when they should be taken, who is the best candidate for adult vaccinations, and what are the role or which will be most beneficial for you. So I will just quickly share my screen for the presentation. Just give me a moment. Yes. Ashwini, is it visible?
Yes, Doctor. It's
Okay.
visible.
Okay, everyone, let us start today. So protect your tomorrow today. That is the motto of adult vaccination. So we all are very much aware about vaccinations, what vaccinations do. There is a proper immunization schedule for our children. And whenever a child is born, it comes into this world, all the necessary vaccines are given. Why they are given? And why do we take them without asking any questions? It is so because they prevent the children from certain very dangerous diseases that can cause them harm or make some permanent damages like polio. So with the help of vaccine, we were actually able to eradicate polio from our country, and today India is a polio free country. So very rarely we see any cases of polio that were long back who had missed polio drops, but in today's date, in last 30 decades, hardly any cases of polio. And undeclared, but almost same goes for tetanus. Nowadays, even in our medical practice, we hardly see any cases of tetanus because people are very much aware, and whenever they get deep cuts or some infected cuts, first thing they do is they go to the chemist shop or nearby clinic and they take tetanus vaccine. So these vaccines are somewhere very, very helpful in preventing the disease and stop it from occurring. And if we are lucky enough, we are able to eradicate certain diseases completely from the country or the world. Like smallpox, it has been eradicated throughout the world in, if I am not wrong, then around 1979. So nowadays, smallpox doesn't exist. So that's why it is very important for a better, healthier, and less health related complications of tomorrow. We take the vaccines today. Before we begin, a small brief about Tata 1mg. Tata 1mg is India's most trusted source of healthcare with over 260 million plus visitors on our website, spread across 1900 plus cities, and till date 31 million plus orders delivered. We have a huge network of partners and partner companies, and it is India's first legit script approved healthcare website. Our motto is accessible, secure, affordable, and reliable healthcare for all. Okay, so now continuing, why we emphasize on adult vaccinations. Even the government has become aware and they are promoting and making changes in the policies to enforce adult vaccinations as well. Except for some emergency vaccinations like COVID vaccination that almost all of us have taken, vaccinations go through a lot of clinical and phase trials, and then only they get approved for users, especially in India. Because you see, yesterday itself, I was discussing with someone, there is even vaccination for dengue available. Dengue in India, it's a big menace. But till now, no vaccination is available. However, more than 40 countries in the world have dengue vaccines that protect them. But our challenge is we have all four strains of dengue in India. And for that, the vaccine has to go through a lot of trials before making it public so that we get complete protection from all the four strains. So these are the challenges we face. But again, we come back to the same question, why it is necessary, why it is important. Sometimes certain vaccines work in the way that their effect doesn't last very long. So we have to keep taking booster doses. So some vaccines that we have taken in the childhood, over the period, over the time, their efficacy reduces as we grow up. So there is always a chance that we can again succumb to that particular disease. So it is important that after a certain age, certain vaccinations have to be repeated or booster dose have to be taken, just like Tdap, that is tetanus, diphtheria, and pertussis. So in childhood, we already take these three. Tetanus, I told you, everyone is taking. Now, recently, government has made mandatory that all the tetanus vaccines will as well cover diphtheria vaccine as well. So now mostly we will get a combination of tetanus and diphtheria vaccine. And then there is pertussis. So that is also available. And the booster dose should be taken every 10 years. Every 10 years, if you take one Tdap vaccine, you are well protected of tetanus. In fact, tetanus vaccine, if you take it once, it gives you a good protection for at least 4 to 5 years. However, people take it very frequently. Still, if they come for advice, I tell them if you have taken it within 1 or 2 years, you do not need to take it again. So, this is the reason that when we are growing, the effect of the vaccine diminishes first. Second, certain vaccinations are specifically made for adults or certain disease conditions that can be given in the adults only, and those vaccines are not given in childhood, but they are important, should be taken, and they have been made for a certain purpose to reduce. See, the basic purpose of all vaccines is to reduce morbidity, mortality, and hospital admissions. That is the key benefit, that no vaccination takes guarantee that certain disease will not happen. The vaccine is to make your immunity stronger. See, let us understand with the help of the next slide. What does the vaccine does? Vaccine basically, enables or makes your immunity stronger. So what happens is, when you are, for example, let's say COVID vaccine. So when we took the COVID vaccine itself contained the COVID virus, the corona novel virus, and they were injected in your body, but the virus was present in very, very micro quantities, and it was a dead virus. So what will happen is, it will not cause the disease in your body. It will not replicate, like cause the same severity or symptoms, because it is in very micro and controlled quantity, and they are dead viruses. But it will replicate the effects of the disease. So the body, our immune system recognizes those viruses, and they prepare themselves for next time. So when actually you get affected with COVID virus, our system has already recognized them, they are prepared, and they are able to fight with the COVID virus. So that is how any vaccination works. All the vaccines contain the same disease product, or a replica of that virus or bacteria, which when enters in the body, our immunity system recognizes them, and then creates helper cells. They are basically called helper cells, and they stop or prevent the disease from happening again. Today, that I will be discussing with you are the four most common vaccines that are being promoted even by the government, and which is very helpful, especially in adult age. These are, first of all, shingles vaccine, which causes herpes. So the shingles disease, the herpes zoster infection. So one vaccine is to prevent that. Next is to prevent the HPV infection, human papilloma virus. Human papilloma virus is very commonly known to cause cervical cancer in females. Then there comes pneumococcal infection. It's a bacteria that causes pneumonia and many other infections, including pneumococcal meningitis in the brain, pneumococcal skin infections, then pneumococcal stomach-related infections. It can cause infection wherever it goes. Even it can cause pneumococcal septicemia if it travels in the blood. And lastly, influenza, or the common cold virus, that we will discuss today. So let us begin. Let us start with shingles first. So for those who are not aware what is shingles, it is basically, I will tell you in very simple terms, it is chicken pox. Okay. So chicken pox is caused by the same virus which is known as herpes zoster. Herpes zoster virus causes chickenpox in your body, and that's why they say once you get chickenpox, you do not get chickenpox again. That is very true, because they form immunity. They If a disease happens to you, that also acts almost like a vaccine. So chickenpox, once it happens, the body prepares immunity against it, immune cells against it, and so next time chickenpox cannot happen because body fights it off. However, in few cases, it has been seen the immunity has not properly formed, or the person is very weak, or his whole immune system is down. In that case, chickenpox can also happen again. Also, now comes the disease known as shingles or herpes. What happens is chickenpox virus does not fully leave your body. It hides itself in the nerve roots. So when you reach a certain age, let's say 50 years and above, your immunity starts getting weaker. When your immune system gets weaker, the virus, if there is any trigger, like for example, you get the infection again, or there is a transplant patient, or the patient is having acquired disease, for example HIV, or the patient is under medications of immunosuppressants, the patient has developed cancer and under medication that is suppressing the cells. In such cases, the even in diabetes also, diabetes, asthma. These patients also get a weak immune system sometimes because they may require steroids in their treatment. This herpes zoster virus takes benefit of this opportunity and it reactivates itself. So you will again get a chickenpox like disease, but not widely spread as that. So what happens is when this herpes gets activated, it is hiding itself in the nerve roots. So the nerve roots goes like this and it spreads across towards both sides. So if the left side or the right side of the nerve root is affected, it spreads accordingly. So you will see when herpes happens, it is only on one side of the body and limited to, like, the trunk area will get affected, or only the left part of the face will get affected, and so on. So it affects a smaller region. There are blisters, rashes, all these things form. However, it is very important to note that it is a extremely painful condition. I have seen a lot of patients with herpes. There is a lot of pain. It is so painful that even if you are not wearing anything, the air from the fan will also cause you irritation. It is such a sensitive condition. There is pain, there is burning, like, the body is on fire. Then there is nerve roots get affected. So there is a tingling sensation, irritation, someone is poking pins on your body like that. And unfortunately, there are complications associated with it. A very widely known complication is post herpetic neuralgia, PHN. PHN can last even if the rashes are gone, the blister is gone, the fever is gone, everything gets better within 1 week. Even after that, the pain, burning sensation, the pin pricking sensation that continues up to 3 months, 9 months, and in certain rare cases we have seen it has continued for years. No medicine works, no painkiller can reduce the pain, and the patient is always agitated. Daily life activities get hampered, the family members are bothered. There's a lot of complications associated with it. Along with that, there are disease related complications itself. Some people get rashes on the face that can even penetrate inside the eye. The person can lose their vision as well. So in such cases, it is known as herpes ophthalmicus, and many other complications can happen. So, to prevent this from happening, such a dreadful complication, such a painful disease, uh, we give vaccine for herpes, which is known as Shingrix vaccination. Shingrix is given in 2 doses. One vaccine will be today, another will be after 6 months. And this is done only once in a lifetime. It will give you lifelong protection. So, 2 doses are given. Anyone who is 50 years or above is eligible for this vaccine. Okay, so this is about the Shingrix vaccine. That Shingrix vaccine to protect the disease caused by herpes zoster virus that causes shingles. Now we come to the next condition. If you or any of you have any doubts or questions, I will take them at the end of the session. I will clear all your doubts. Now, next condition is HPV, human papilloma virus. This has also, nowadays being talked about a lot. Even the European government, especially in UK, it is being promoted. The government is promoting everyone to take this vaccine so that the HPV condition can be eradicated. See, this human papilloma virus basically is a causative factor for cancers. It causes cervical cancer in women. Every year, around 1 to 1.5 lakh women suffer in India with cervical cancer. Similarly, it can cause rectal cancer or prostatic cancer in males, and it can cause skin related cancers as well. Some people you will see they get skin tags that come out of the face or necks. It is very common in the neck area, or warts. There is genital warts. So that is also caused by human papilloma virus. So this virus can cause there are different strains of this virus, and whichever strains the person is getting affected with can cause different effects on the body. So, what we suggest is everyone should get vaccinated, because at least one cause of cancer gets eliminated from your life. So, if you take this vaccine, you are protected against one cause of a cancer, that is human papilloma virus. And this is also has to be taken a course of 3 doses, taken only once, and then you are protected for life. Usually, it is given during the childhood period or the period when a person is most sexually active. So, in children, it is suggested to be given from between 9 to 14 years. Between 9 to 14 years, you only require 2 doses. One dose today, one dose after 6 months to be completed between 1 year. So, only 2 doses in children for 9 to 14 years. Above 14 years, from 15 to 45 years of age, this is given in 3 doses. Those who are above 45 can still take it. However, it is not indicated, because the amount of protection that it can give up to 45 will not be same if you are taking it above 45 years of age. But if there is no as such contraindication. If a person is 46, 47 and they wish to take it, they can. But from 9 to 14, 2 doses. From 15 to 45, 3 doses. First dose today, second dose after 2 months, before 4 months, and third dose after 4 months from the second dose and before 1 year is completed. So there are total 3 doses in adults. This vaccine protects you from human papilloma virus, which is a cancer causing agent, cervical cancer in females, prostatic cancer in males. The prices displayed here on the screen are the MRP which it is available on, but there are discounts available everywhere in the market, even on Tata 1mg. You can further inquire regarding this later. Now, coming to our next vaccine, this is the pneumococcal vaccine. Pneumococcal vaccine is a protective vaccine against bacteria. Pneumococcal vaccine uh, protects you against pneumococcal bacteria that can cause you lot of conditions. As I just told you, it can cause pneumonia in adults, especially hospital acquired pneumonia, which is a very common condition in people who get admitted, who stay in the ICU for some time, or in the cardiac care unit. It is very common for them to get infection from the hospital, especially hospital acquired pneumonia, HAP. So in that case, most of the time it is pneumococcal pneumonia, and it can be protected by use of this vaccination. Pneumococcal bacteria can cause other conditions other than pneumonia. It can cause you meningitis, encephalitis, that is the inflammation of the brain cells, the protective covering of the brain that gets inflamed in meninges. Also, if it goes into the bloodstream, it can cause septicemia, infection of the blood that can throughout the body, and it will cause you fever. It will not come down easily. There will be cold, shivering, coughing, and in severe cases, people can even lose consciousness, and eventually there is death. So, to protect such type of conditions, it is always advised that you take these vaccines. They are very much protective up to a certain extent. If even if you still get the disease, it will be not be that severe. Your immunity, your body cells will already be ready for them, fight with them, and the condition will improve within a few days without much intervention required from the doctor or the hospital. People who specially have conditions, lung related conditions like COPD, asthma, or conditions of the heart or kidney, they are on dialysis, kidney transplant, they visit the hospital frequently. People who have diabetes, they can get this disease. People who are smoking, having alcohol, lungs has become weak, immunity is weak. So it is very easy to get contract this pneumococcal infection. Pneumococcal vaccine is available. It is available in two different forms. Pneumococcal vaccine is available as Prevnar 23 and Prevnar 13. So there are two forms. In one, it is covering 23 type of strains. In the other one, it is covering 13 type of strains. But it is always advised that you should go for the pneumococcal 13 vaccine first. Pneumococcal 13 vaccine is prepared by a different method which gives you better uh, protection against the disease. Pneumococcal 23 is a conjugated vaccine. It will not give you as effective a protection as pneumococcal 13 strain vaccine.
So, doctor,
So,
just to add one more point, Dr. Satak, in this only. I mean, so we have this polysaccharide pneumococcal 20 also available now with us instead of 13. So,
yeah,
we have 20 which covers 20 strains. So that is much more effective than 13. Yeah.
okay.
Polysaccharide. So Prevnar 20 by the brand name Prevnar 20. We have Prevnar 20 as well.
Okay, okay. Thank you. That is good news. Earlier that was not available, but as Mr. Vineet, my colleague, just told us, Prevnar 20 is available, and it's a polysaccharide method, same as the 13. So in that case, Prevnar 20 will be more beneficial for all the seniors who are above 60, 65 years of age. They can go for this disease. And it's a single dose vaccine. You have to take only once and then you get protected for life. You don't have to repeat it. If your doctor advises you, in that case, you may have to repeat it one more time after 5 years for a booster dose. But it is especially for those people who have asthma or have some heart conditions, your doctor will advise you. Otherwise, it's only single dose vaccination and that's it. You don't have to take it again. Yes, I missed a point. Similarly, like, sorry, I have to go back. Yes. Similarly, like pneumococcal vaccine, HPV vaccine also has two different variants. One is 4-strain vaccine and the other one is 9-strain vaccine. The 4-strain vaccine contains 4 different strains of the human papilloma virus. And the 9th strain contains all the strains of the human papilloma virus. So there is mainly a price difference between them. The 4-strain type of vaccine costs around 4,000 rupees, whereas the 9th strain, the complete strain vaccine, costs around 10,000 rupees. So, what is the difference between them? The difference is basically the 4 strains that are covered when the 4-strain type of vaccine, they protect you against the cancers. But if you want complete protection against all the variants, because you never know when a virus can mutate and have different effects. In that case, it is known as Gardasil 9. The 9 variant vaccine is most effective and advised by the doctors. Gardasil 9 protects you against all the different variants available in the world against human papilloma virus. So yes, 2 type of variants of this vaccine is also available. One is type 4, one is type 9. Now we will discuss about influenza vaccine. Influenza is a very common conditions in our day-to-day life. We face common cold, and especially since COVID, I will tell you in my personal experience, as I see in my clinical practice, a lot of uh, patients come with different symptoms each year. The influenza virus keeps mutating. This is the reason, because even after uh, so much excellence in healthcare, the common cold, we could not conquer the common cold with all the modern medicines we have, because this virus is very tricky and it keeps mutating. So every year the symptoms vary. It is same, the cold, cough, fever only. Earlier, the fever would last for 3 days, and then it kept increasing. Now sometimes the fever continues even up to 7 days. Also, some year I see the cold and cough is continuing. Just like this year, the cough is not reducing up to one month. However, some year we see the cough and cold is very less, the fever is more. People are even shivering in the fever, which was used to be a common symptom for dengue and malaria. But nowadays they are shivering in influenza viruses also. So the virus is very tricky. It sometimes even mimics COVID-like symptoms, and it causes many other kinds of diseases. Influenza virus causes swine flu. Influenza virus causes avian flu. And in fact, I think avian flu has recently been detected in some parts of India. Bihar, I was seeing the news. So it bird flu that we call it, avian flu is bird flu. So H1N2, H3N1, all these viruses, different forms are there, which can cause you different kind of diseases. Influenza A virus, influenza B virus, all the symptoms are same. So we advise influenza vaccine to protect you against this. And it is truly very effective. I am seeing this in many of my patients and even my family members, where if you take this vaccine once every year, it gives you a uh, beautiful amount of protection against the disease. You hardly get any cold, cough, or fever, or even if you get, it lasts 1 or 2 days only. So, influenza vaccine is very much recommended. However, it is taken every year. As I told you, the virus keeps on mutating. The WHO makes a research report, it submits, and they tell you which is the form or mutation it has taken place. Then each year, new vaccine is prepared, and by the month of um, August, we get the new vaccines in the market. So, ideal time is to take it after August till February end. After that, it can be taken any time of the year, but after that, again, new forms come. So it is very much beneficial when right now the influenza season is going on. A lot of people are falling sick, especially because of the weather change and pollution as well. So it is advised in everyone. Anyone can take it from 6 year of age to 99, 100 years of age as well, even beyond that. So influenza vaccine protects you against the common cold or the influenza virus and different forms of influenza flu that is out there. It is not very costly. It costs around 2000 rupees and it is given in the hand. Now, I will also include a few other vaccines which are not to be ignored. One I get very commonly is people come and ask me about rabies vaccine. Rabies vaccine will also come under an adult vaccine where, see, there are two situations. One is a roadside stray animal has bitten you, or a home pet has bitten you. Biting is important. Scratching with the nail does not spread rabies. They have to bite you with their teeth. Blood will come out. However, remember, it's not only the dogs, cats, squirrels, rats. Many people come that I was sleeping in the night and rat has bitten me. Even after that, also rabies vaccine is advised. You never know if the rat had any wild animal, monkeys, foxes. Like, I'm just giving an example, but anyone can get a rabies because it's a virus, most commonly seen in dogs and cats. So if they have bitten you, if they are pet, please ask the owner to produce you the vaccination card. If they have been vaccinated within 1 year, then it is fine. You do not need to go for the rabies vaccine. But if they are not able to provide you with the vaccination card, do not take risk. Please vaccinate yourself. It is very important because this is the only disease condition that do not have any treatment. If you get rabies, no one in the world will be able to save the person. So it is always advised you take rabies vaccination better than taking the risk. There are total 4 doses, and then fifth dose is a booster. You may or may not take it. You take it 4 doses on the hands alternatively. So rabies vaccine is also very important and available everywhere. So these are some of the adult vaccines, like as we discussed, influenza, Shingrix for shingles, herpes zoster, HPV vaccine, Gardasil 9, Gardasil 4, and pneumococcal vaccine, that is Prevnar 20, Prevnar 13, and Prevnar 23. These are available. Along with that, as I told you in the beginning, Tdap is also very important, tetanus, diphtheria, and pertussis, to be taken once every 10 years. If you have not taken it yet, take it now. Then you can repeat it after 10 years again if required. When to take the tetanus? If there is a deep cut with rusted iron articles, or roadside accidents where the wound can get very much infected. So that is the time when you take tetanus. If you are just getting a simple small cut or paper cut or something like that at home, or getting cut with the knife, which is a very clean and new knife in the kitchen, you do not need tetanus. And other than that, there are a lot of other vaccinations available, which are very particular vaccines, which may be required when while traveling. For example, if someone is going to Africa, in that case, they can take the yellow fever vaccine, which is also advised by the government itself. Then other vaccines are also there. So these are the few adult vaccines which should be commonly taken by everyone to protect themselves. As I told you, not on it is only required in children, but also required in all the adults. As our immunity decreases, we need to protect ourselves from the impending disease, which reduces the severity of the condition. Thank you, everyone. Please feel free to ask if you have any doubts or questions. I'm open to questions.
Thank you, Doctor.